And I want to be very clear today. Alberta's government is fully, and I mean fully, committed to taking action to stabilize, to strengthen, and to improve Alberta's primary healthcare system. One goal is for every Albertan to have access to a primary healthcare provider when and where they need it. Another goal is for Indigenous peoples to have access to appropriate care that meets the unique needs of their communities and is free of racism. There are no easy solutions to get us to where we need to be on both these fronts. To achieve these goals, we must make primary health care the foundation of the entire healthcare system. So today, I am pleased to announce a number of immediate actions that will help to stabilize and strengthen Alberta's primary healthcare system. First, we will be forming a task force with a number of specific tasks, including developing an improved compensation model for family medicine, with the goal to better support physicians and their teams to have a viable practice that can meet all the care needs of their patients. The task force will find ways for primary care providers to spend more time with their patients. This means finding more efficient ways to manage administrative work, like filling out forms, tracking lab results, and managing referrals. The task force will also recommend other measures that can be implemented in the short term to further stabilize primary care. The work will begin immediately, and it will have a very short window.
For some, the recommendations will not go far or fast enough. For others, implementation of the 11 recommendations might feel uncomfortable. There is no perfect system. We view the recommendations as a package and recognize the need for a carefully planned transition. We also need to recognize that we will be learning and adapting along the way. I want to emphasize the 11 recommendations in the Strategic Advisory Panel report should be considered together with the independent advice in the Indigenous Panel report. Synergy should be sought, equity advanced, and actions to eliminate discrimination and racism in our healthcare system should be immediate.
I know the best solutions exist within our respective communities, tailored for our unique needs and priorities. The commitments made today are an important first step toward improving health equity for Indigenous people, regardless of where they live in Alberta. And we call on the federal government to look at what is being done here in Alberta through the work of Alberta's Strategic Advisory Panel and the Indigenous Primary Healthcare Advisory Panel to modernize their own approach and their important role and responsibility in advancing equitable healthcare for Indigenous people in Alberta and across Canada.